Welcome to TMI, a podcast by Henry Ford Allegiance Health. And today, it's a hot day in the studio. Summer outside. Tim's on the couch here.
For now, summer's outside.
Yeah, but the fall is coming up so quickly. And my little guy, Willie, he's getting ready to go into kindergarten.
So, man, that's exciting.
Yeah, so we're getting him into the doctor, getting all his tests, making sure he's got all his shots, his booster shots and everything. So this is the time of season where we're thinking about that kind of stuff. So what are you thinking about, Tim?
Flu vaccines, obviously. And then we've had, now I know they're in the news lately has been the getting boosters for COVID as well. Right. So that's been kind of an important thing as we move indoors for the fall. So that's kind of been on my mind. And that's kind of why we have our guest here today. It kind of triggered my thoughts in my head is, with COVID-19 and all those pieces, what other effects has it had besides obviously getting sick with COVID? And so I was thinking about health screenings, and I've heard anecdotally people delaying things. But anyway, we'll get to that in a second. But I do want to introduce our guest today. Sorry, Dave. Dr. David Kolde, MD. He's a primary care physician here at Henry Ford Allegiance. He's also the medical director for primary health for Henry Ford Allegiance Medical Group. So welcome, Dr. Kolde.
Thanks for having me.
So I kind of mentioned to Dave, there's a lot of things that COVID-19 has affected in terms of healthcare, not just obviously getting sick. And I've heard, anecdotally, people just kind of sharing stories that, getting health screenings has been one of those pieces. And I kind of want to try and unpack that with you today. I guess, have you heard that or seen that yourself?
Sure. In the beginning when COVID hit, a lot of screening opportunities were just shut down. We had, such an unknown on, how do you get COVID, how's it transmitted, that kind of thing. That the screening opportunities we had for colon cancer screening, mammography, things like that, a lot of places had significant reduction in service. So just that alone cut down the number of screenings. And then people were afraid. They were afraid that if I go to a healthcare facility, I'm going to catch it because that's where all the sick people are. So there was just a lot of people that just screening was not on their radar. They hunkered down at home. And so I have no doubt that when they do the studies, the epidemiologic studies on this, that we'll see rises in cancers that could have been detected earlier. Anecdotally, I've got colleagues, I've got stories of people that delayed breast cancer screening or colonoscopy screening that, have a little more advanced disease than they would have had they caught it, 2 years ago. And now everybody's trying to catch up with screening, or at least the physicians are trying to get their patients to catch up. So we have capacity issues in how many people can actually get screened. Even here locally in Jackson, we have a limited number of spots.
Yeah. So I'm going to take a step back here. You mentioned like mammographies and I think colonoscopies. I think those are some of the bigger ones that people always think of. But can we kind of define what, preventive screenings are? There's probably more than that we don't really realize is important to be tracking or looking for.
Yeah. So, at the beginning, you mentioned your kiddo is going to go into kindergarten. So that age, it's really important vision screen, to make sure that they see okay and that they don't need to get glasses to correct vision. So that's a really key age to do that. Every age, there's really something that we're looking for as far as developmental milestone or things like that. Blood pressure is always something that we're looking at screening because a lot of people have high blood pressure, don't feel it. And the comorbidity or the illnesses that can be associated with that, will sneak up on you. And you don't know that you have high blood pressure until you've had your heart attack or your stroke. And these are things that really we can prevent. So certain metabolic diseases like diabetes, cervical cancer screening, of course, is another one. But we look at weight, blood pressure. We talk to people just, for elderly, it's like you get a sense of, are they still with it? Or is, mom and dad starting to kind of lose a step in their memory, things like that.
So screenings necessarily aren't always physical exams to some extent.
To some extent. but most of the time there is some sort of testing involved that's been shown, hopefully, to be a benefit if we catch something early that we can have an impact.
Okay.
That's great. And so we go to our family doctor pretty regularly. Mm-hmm. Is that a place that they kind of do these screenings while we go in, or is this kind of separate, or can we request that
Yes.
be done?
Yeah. The primary care doctor's office is probably the best place to go. There are a number of other places that might offer services. You will get people trying to sell you lots of things. But in your office, in your primary care doctor's office, they should be offering you things that are of proven benefit to you, that are cost effective, that aren't going to be wasting your hard-earned money.
Okay. And then I think you kind of alluded to it a little bit earlier, but just to kind of solidify, like the point of screenings, is it to prevent? It is, I think, partially to prevent, but also to detect, right?
Correct. Best case scenario, we prevent something, right? So the classic example, one of the quintessential best screening test is the Pap smear. It's been around for a long time. With the Pap smear, you can detect pre-cervical cancer, which then will allow you to follow it more closely so that woman will never develop cervical cancer, right? Because we can treat things in the precancerous stage. Colonoscopy would be a similar thing. You go in and you get an adenoma plucked out, which is a type of polyp that has a tendency to turn into a cancer if you let it go. And I can tell you my own personal story. When I had turned 50, I got my screening colonoscopy like I should, as I tell everyone to do. And lo and behold, I had polyps. And thank goodness I went in at 50 because my polyps were already cancerous. Oh, wow. So I had to have surgery and to have it removed. And I'm glad I did. Otherwise, 3-4 years, if I would have waited till I had symptoms, probably would have been a much different scenario.
Yeah. So that was definitely detection, but also, again, prevention.
Prevention.
Too. Yeah. With some of those, I know screenings, how invasive, I guess, can you kind of talk about some of the different screenings? Or I think there's some people that may be nervous, like with, going to get a colonoscopy versus getting your blood pressure tested. That's not too bad with a cuff on your arm.
Right. Simplest thing is we weigh you. You stand on a scale, right? I mean, that's pretty easy. Blood pressure, something wraps around your arm, you feel a squeeze, get to feel your own heart rate. So those are really non-invasive type tests. And then we start doing blood tests, where you need a blood sample, obviously, to the more invasive things like a colonoscopy. But there's new technology that's come out, over time so that we can detect some colon cancer or at least abnormalities via a stool sample. You've heard and seen the commercials, Cologuard, right? So we offer that test as well. And it's appropriate for certain people, not everybody. So there's different ways to test for different things. Mammography's come a long way. As guys, we don't necessarily have to have that test, right? Yep. Although I have had in my career 3 men with breast cancer, and they had the experience of getting a mammogram. But mammography has come a long way from what I'm told, that it's more bearable than it used to be.
Anecdotally, I heard from some people it used to be a lot more painful.
Yes.
Where it's not so much anymore.
Yeah, it's better.
Again, I don't know personally,
right.
Just from what I've heard stories.
Yep.
So what, I guess, kind of can you talk about like the basic screenings that, as adults, or maybe some of the basic age screenings that we should be getting?
Sure. So, I'd start off with infants and children. You're looking for developmental milestones. Can the kiddo grasp onto a rattle? Can they roll over? When can they sit up and, support themselves? When are they walking? When are they starting to talk?
Okay.
These are the things that, it's really important for your well child checks, that are at 3-month intervals, 2-month intervals, 2, 4, 6 months, then 9 months, then 12 months, then 15 months, then 2 years, and then 1 year after that every year. So to make sure that your child is growing, feeding appropriately, and not missing anything. It's also the opportunity, it gives us to make sure that we get them immunized with their primary immunization series, which has really been shown to benefit. Then you get into the teenagers, and you have a little different animal there, and that they're not as talkative usually. A lot of times they'll be quiet, and so you observe a lot. You get some history from mom and dad. You start to inquire about drug exposure and depression and identity issues and those types of things. And we've got tools, surveys that they can take that help us identify those things that we then can impact, hopefully through different therapies or counseling to make a difference, to improve their life. Then you get to the young adults, and it's about safety, really. If you've made it through your teen years, then we start to really worry about drinking and driving and those kinds of safety things, risk-taking activities, sexually transmitted diseases, etc. Again, depression, anxiety has been increased since COVID, particularly in the younger age groups. So that's something that we look at. All the while, we're checking your blood pressure and your weight every time you come in to make sure that you're tall enough for your weight, I should say.
Yeah.
And then you start getting into the 30-year-olds, 40-year-olds where people maybe start developing some chronic disease, high blood pressure, or they've been maybe carrying a little more weight than they ought to, and so they're starting to have a little bit of insulin resistance and developing type 2 diabetes. So we do check some screenings for blood sugar, kidney function, cholesterol, to make sure that, if you've got a family history that's significant for cholesterol, we're not going to wait till you've had your first heart attack to kind of say, oh, maybe you should be on cholesterol medicine.
Yeah.
Right? We want to try to, again, intervene at a much earlier stage so that we can avoid, some of the bad things that happen, which most people would be appreciative, if we can prevent mom, dad, brother, sister from having a stroke, a heart attack, that kind of thing.
Yeah, kind of bring up the family part of it.
Mm-hmm.
Sorry, a little off topic, but screenings, I guess family history plays a role, I think, with some of these screenings.
Absolutely can play a big role in screenings. For people that have certain cancers that run in the family, we want to screen them at an earlier age. If you have people that have certain disease processes, culturally too, if we all learn things from our parents. And so if type 2 diabetes is in mom and dad and they're heavy, there's a good chance that you've learned how to eat from mom and dad. And so that you may also be a little bit heavier, which, kind of predisposes you then to maybe getting type 2 diabetes. Mm-hmm. May not be a genetic thing, but just your own day-to-day
behavioral piece of it, which I completely understand. And I guess the good thing is education too, knowing about it. Yeah. I know my grandparents were actually diabetic. My mom is pre-diabetic, but because I'm aware of all of that, I'm actually trying to work on preventing that or, watching what I'm eating. And I understand that now.
And there are some ethnic groups that are more predisposed to things like diabetes as well. So that's another thing for us to be considering.
Okay. And I kind of took us off track. So you were in, when we're age 30 or 40.
Yeah. Okay. So
sorry.
Then you, the pap smears start in the 20s as well, 21. We are testing for different cancers, sometimes breast cancer early, depending on the family history. And so that's where you really start to see more intentional screening and questionnaires regarding family history for certain groups, high-risk groups. By 35, everybody should know their cholesterol for sure. And their blood sugar, their blood pressure, their weight, those kinds of things. Used to be 40, every guy would dread when they turned 40 to go into the doctor. Things have evolved. We don't have to dread that anymore. The idea of the physical exam, the yearly physical, is mostly a traditional thing. The things that are important when you go into your doctor is you tell them your story. they should be asking you questions that then direct the testing that you do if there's any other testing besides our basic screening. You get a lot of patients that come in and they want, well, can you do a blood test that tells me everything? And while we're not there yet, there is technology being developed, and Henry Ford's going to be participating in this, actually. And it is a cancer test. I will say that it's the Gallery test, and it's going to test for something like potentially 50 different types of cancer. It's not perfected. We're going to help validate it. But it is something that technology is coming. So,
wow. Okay. And then you mentioned as you get older, I guess I know there's other screenings. And in particular, I've helped to, at least for the health system, working with like arterial and vascular screenings. But there's a certain age to get them. You don't want to get them too soon. And then I know, I think my understanding is you don't do them as often either. I mean, is there time periods like blood pressures every year? You know, there's some screenings that you would get every 5 years or more often, less often.
Yeah. So the classic examples for the different cadences would be pap smear. You know, they can be every 3 or 5 years, depending on the type of pap smear and the age that you do, you know, whether there's what's called a co-test with it or not. Mammography, you know, Henry Ford has their policy is every year after a certain age. Starting at age 40, you get your baseline.
Okay.
Things like cholesterol. If your cholesterol is good and your numbers are fine, and you've not changed your diet significantly, your weight, you know, hasn't changed drastically, you don't need to check that every year. That can really be every 3 to 5 years. Things like a PSA, you know, the U.S. Preventive Services Task Force is it's an organization that we use in primary care that gives us a big list of recommendations for all the different types of screening based on all the available literature. And so things like PSA, we would say from the U.S. Preventive Service Task Force, it's age 55 to 70. There are different specialty groups that would have a little different age range on that, but in general, you know, primary care will use the U.S. Preventive Services Task Force because it tends to have maybe a little less bias towards a particular specialty, one or the other. But you know, it's based on data, and it's not just family docs that sat around a table and did it. It's a bunch of experts in the field that went around and did this. So that's one tool we'll use to choose. The other things like lung cancer screening is a big one now too. It's been promising. Currently, it's 50 to 80, and you have to have a certain smoking history. They're going to be lowering the age to 45. And Henry Ford is maybe even going to change some of the smoking requirements because that's notoriously inaccurate when you ask somebody, so how long have you smoked? How much have you smoked? You know,
depending on their memory.
Yeah, people just kind of guess. Colon cancer screening, you know, that's one where it's been age 50 for a long time, unless you had a family history, which would start maybe at 10 years previous to the diagnosis of a first-degree relative. So if your mom had colon cancer that was discovered at age 53, you would have gotten yours starting at age 43. So my poor kids are going to have to start at 40 because I got my cancer at 50.
Yeah.
So they already are starting to give me grief about that. And outside of that, you know, then you start talking about mental status evaluations and stuff like that. For the most part, it's conversational stuff that you'll pick up that might lead you to, hey, you know, let's do this little mental status test. And there's a number of validated things. One big one I forgot is depression screening. You know, that's something that we really start doing at age 12. And that's kind of an important one.
And I imagine probably with some of these baseline ones that you can do, your family doctor would do. It's important to have somebody they have that relationship with, so you can kind of keep an eye throughout the years.
Yeah, because we, the medical record now is nice that it's electronic. In some ways, it's easier to keep things organized.
Yeah.
And so it also prompts you, as a physician, you can click on somebody's health maintenance record or another screen that will say, so-and-so is due for X, screening, so that you don't always have to go back in your head and think, okay, this person's, 42 and they're a guy and, X, Y, and Z. It just kind of helps you. So that's really been a big help. And then we are able to keep nice, neat track of what tests have been done, where they've been done, the results, et cetera.
Okay. You can start some of these going to your primary care. I think people probably wonder too sometimes is, with insurance, does it have to, for some of the larger things like a colonoscopy, would they have to be referrals, or can you just say, I want a colonoscopy, I should, get a hold of that doctor, a gastroenterologist? Or
So in a perfect world, people would know what they need and do it that way. But, there are a lot of people that would, maybe they're a little anxious or nervous and they would get a colonoscopy or want to get one every year. Yeah. Totally unnecessary, right? So, yes, to keep the chaos down, I think it is best done through, your primary care doc so that they kind of make sure that you're getting the right screening at the right cadence. Most insurances will require some sort of primary care doctor to have those results sent back to.
Okay.
Because if you're a private citizen and you just say, you know what, I think I want to go have a colonoscopy, and the GI doctor does the scope and says, okay, here you go. Here's your report. Good luck.
What are you going to do with it?
What are you going to do with that, right? I mean, what are you going to do with the fact that, I've got, I had 2 tubular adenomas. What is that, right? So you need to have somebody on the other end helping you to interpret it. Henry Ford does have, some unique things in that as a female, mammography is something that is a well-established screening tool. And so you actually don't need the doctor to order it. You can actually self-order your mammogram. They will check and make sure that you haven't had one yesterday.
Yeah.
But you don't need to wait for your doctor to order it. If you know that, hey, I had mine last August, I should go get one, you can call, make your appointment. So that's nice. You should have your primary care doctor, though, still, because they need to send those results to someone. Otherwise, that's a problem.
Yeah.
So.
Great. Yeah. That's a lot. That's a lot of screenings.
Yeah.
But yeah, it's just something you need to do every so often.
Yeah. And I think the important part for me, you mentioned, you're used to the typical annual exam, it is, I was going to phrase this here. Cause I haven't gone in a while. Putting this out there. I haven't had an annual wellness check.
You're perfect. This is how I would approach a person like you.
Okay. That's what I was wondering, because I went, it's been several years. My primary care doctor, he retired. That's why. And then there was a pandemic in between. Mm-hmm. So it's been several years since I've had an annual exam or a well check, I guess.
So you're somebody that I would deal with quite often. And my ask would be, do you own an automobile?
Yes.
Okay. How often do you change the oil?
Every 3,000 miles.
Why?
So it runs well.
There you go. So I tell people you should treat yourself at least as well as your car. It's preventive maintenance, right? You don't want to have your car have 100,000 miles on it, never having changed the oil, be in the middle of nowhere, and then just stops running, right? So in the same vein, if we can keep you running better by keeping your cholesterol good and your fuel, you'll fuel pump, your heart, doing well, you're not going to be out in the middle of nowhere maybe and just drop dead. So
my wife would appreciate that.
That is the analogy that I will often use for guys. Tend to be a little bit more hesitant to come in to the docs, but
it just hasn't been top of mind. I think that's kind of where things have been probably for people lately, is because of the pandemic. Mm-hmm. These screenings or getting your checkups just haven't been top of mind.
Yeah, and I think that's important for us to talk about. I mean, that's why this topic's so important to talk about, is because it breaks down that barrier for people to just go in, don't be scared that you're going to have to do all these tests or go through all these things. You just walk through and trust that the person guiding you is able to just, tell you what to do.
Yeah, there's been, with the pandemic has come a lot of polarization and trust or mistrust with the medical establishment. The vaccine itself for COVID has certainly not been 100% well received, I will say. And there's been, to some degree, an attack on science. So a number of my colleagues and I, we in primary care, we kind of have to deal with that. A lot of misinformation out there on what's effective, what's not effective, from a screening standpoint too. Yeah. What should you get done? What shouldn't you get done? Why is it important? So that's why, it highlights the need to go to your primary care doc and have that established relationship. I do send patients to, certain websites. U.S. Preventive Services Taskforce.org is a good one for screening. Okay. You can plug yourself in there and it'll kind of tell you what you should have done. And it's based on evidence, different levels of evidence as well. So that's helpful. Immunizations would also be considered a preventive measure.
So like my flu shot that I need to get soon here.
Yeah, there you go.
Mm-hmm. So, and we'll include that website that you mentioned on some of our show notes, so people can kind of check that out too and see what screenings they should be having at certain ages. So that's great. Thank you.
Awesome.
And I do want to say thank you, Dr. Kolde, for coming on and talking with us about screenings, because it is an important topic. I know you don't want to delay. I know you said we're trying to get caught up a little bit, but we still don't want people to delay their screenings either.
Right. Mm-hmm. No, it's been my pleasure. I mean, this is a important topic and clearly it's near and dear to my heart. So
thank you.
Thank you. And if you want to listen to more of these podcasts, you can go on our website, henryford.com/podcast, and find all the episodes we've done before on a variety of topics. And we plan to do more of these. So check back often. And they're also on iTunes and Spotify and a bunch of different places where you can find podcasts.
Stay healthy.